One day, a thunderstorm arises, and people are trying to get home. A bystander seeks shelter when suddenly a bolt of lightning hit the tree, striking the woman. Fortunately, the man who observed the occurrence inspected the scene, put on a mask, and went to save the woman. He transfers the patient to the nearby house for safety. He positioned the victim into a supine-lying position, instructed someone to call 911, and place a face mask to the victim. He then simultaneously checked if the victim is still breathing and has a pulse. Because the patient is not breathing and has no pulse, he performed CPR on the patient until emergency personnel arrived.
There are 5 different ways you can get hit by lightning. What people usually think of first is a direct strike. It is when you are struck directly by lightning discharge. It's definitely the most dramatic and deadliest of strikes since it can travel through nervous and cardiovascular systems, but it's far from the most common. The most common strikes are ground currents. It is when lightning hits the ground and current is transferred through the ground to you. This ripples through larger areas and are the leading cause of lightning-related injury and death. Anything metal like plumbing or faucets are highways for lightning. This is what we call contact strike. Conduction happens when you are in contact with any of these easy access points, which sometimes even include doors and windows. And there are what we call side flashes. This happens when lightning bounces off something like a tree or telephone pole. That flash of current will hit anyone near these tall objects. This may injure multiple people at once, as when a group huddles close to the object that is struck. The final way to get hit by lightning is through streamers. These energy bursts happen when the atmosphere becomes charged with electricity. Streamers move upwards from objects and people close to the ground. You have 70 to 90 chance of survival if you are hit by lightning, but you'll still face painful injuries such as burns and have a 75% chance of developing permanent sequelae that includes muscular weakness and pain, photophobia and cataracts, deafness, and disturbances of neurologic control such as brain injury, seizures, and nerve damages. In the emergency room, the usual cardiac and trauma treatment principles apply, including assessment and stabilization of the airway, breathing, and circulation. Lightning victims in cardiac arrest have better prognosis than those in cardiac arrest from coronary artery disease, so aggressive resuscitative efforts are indicated. Perform secondary examination to detect occult injuries. Cutaneous burns may help identify the current path and suggest potential organ injury. Admission should be considered for patients with persistent muscle pain and other abnormalities. And lastly, follow-up is recommended to assess delayed effects of lightning, even for patients with no apparent injury.
Lightning can happen as far as 16 kilometers or 10 miles away from the thunderstorm, so pay attention to the signs that lightning is in the air. If your skin starts to tingle or if the hair on your arm starts to rise, that's a sure sign of electricity. And if you hear thunder or kicking noise, that's another sign to get somewhere safe. Seeing as most people don't carry around a suit of armor or a Faraday suit, a car is your best bet. Make sure the windows are closed and don't touch anything metal. Lightning will travel through the metal of a car into the ground, passing by you harmlessly. Avoid open areas, especially hills. Stay away from any body of water, like pools, rivers, lakes. Hiding under a cave entrance or other overhang seems smart, but in reality, you will be acting as a conductor and lightning will seek you out. Shrink your physical footprint as small as possible by crouching down and placing your head between your knees, similar to a tight ball. Cover your ears with your hands to prevent any hearing loss. Your head acts as the entry point for lightning, which travels you out your feet. The smaller you make that distance, the better your chance at surviving with minimal injuries. If you have a backpack or a foam mat, hop on that. According to the National Oceanic and Atmospheric Administration, you have 1 in 3,000 chance of being hit by lightning in your lifetime. So remember, the helpful motto, when thunder roars, go indoors.